am so excited to have with me today an expert in the field of menopause. I'm going to tell you why. You know, so many times women are not understood when they go through that time, particularly by men, corporations, etc. But it's vital if we're going to really move forward as a people, planet-wide, that we understand one another. And I think the most important thing is to understand the opposite gender and the things that they go through. Menopause is a challenge that women face inevitably, either through hysterectomy or either through just the basic change in life. But when they deal with that, how do we as men respond? What support can we give? How can we indeed demystify menopause for both men and women? Well, let's talk about Ms. Doris Ziegledorf, because she does just that. She works with women to navigate their menopause journey on their own terms, transforming their symptoms that limit their daily life to regaining their vibrant health, the life they love living. The virtual practice of demystifying menopause, transformational life coaching at Doris Ziegler LLC, or Doris Ziegledorf LLC, where she works with women to choose their options of hormones or not. That we're going to get into that because that's an important point. She has years of experience using bioidentical hormones, or BHRT, to manage the symptoms of menopause that interfere with activities of daily living. For over 20 years, she's provided primary care with family practice at Clearwater Medical Clinic in Lewiston, Idaho, as provider or owner with a passion to help women navigate their menopausal journey. So we're going to really do a deep dive into menopause so that we understand what it is. And of course, women are saying, I know what it is. But for all of us, for men, for perhaps some young women who have not really approached it and need the information to understand what their older sisters and mothers are going through, we're going to talk with Miss Doris Ziegledorf. Miss Doris, welcome to Crush Your Mountain Health.
Thank you. I'm happy to be here and appreciate this opportunity for this conversation about this topic. I'm passionate for the women who go through menopause because it's not an option, it's a fact of life. How they go through it is sometimes suffering, and I feel suffering is an option. And there are other options that I love to navigate my patients through.
Excellent. So let me ask you this question then. Why does menopause need demystifying?
I think there's a mystery about menopause that women don't talk about, and we kind of lost that communication between women in their 20s and 30s and maybe their grandmothers, or women as they get to be in their 50s and their moms are gone. So we don't converse about the symptoms. And so we kind of keep it as a secret, hoping not to share my vulnerability with any of my friends who might think less of me. So I think we have to demystify it and talk about what it is and how you can navigate it on your own terms. It's not a one size fits all.
Well, there are certainly many different symptoms of it that are commonly known, okay? But now, what are some things that are not commonly associated with menopause that women experience pretty often?
So one of the things can be cardiovascular. So women can have heart palpitations that they won't recognize are part of the decrease of estrogen in menopause. That puts their risk for stroke, heart attack. And the other one is osteoporosis. So women will have joint pain, or women will have bone loss because of the drop in estrogen. Estrogen is circulating in every organ, but we don't always recognize that that person's at risk for a fall. And if that fall happens again, there's a potential for a fracture. Some other things are bladder things. So some women feel like as they get older, they're just going to have to get up in the night multiple times, or they're going to have to run to the bathroom. And again, a lot of those symptoms are menopausal, and it's because of the drop in estrogen.
You know, you mentioned estrogen. Of course, there's estrogen, progesterone, testosterone, all of those hormones are in the body. Is it true that when the estrogen decreases, that the testosterone sort of increases and it causes some of the changes in women?
It is. As we lose the estrogen that circulates, that helps us with our hot flushes and our sleep patterns, and our mood swings. Sometimes it leads to anxiety and depression. So as that estrogen level drops, again, so does progesterone. And again, progesterone's that precursor to testosterone. So when those two levels drop, then that testosterone level can rise. It can make us a little more irritable or a little bit more moody. And again, the goal is a balance of hormones. So we balance those male and female hormones, again, to regain vibrant health or maintain it if we start looking at the symptoms early enough and not just brush them under the rug saying, I don't want to deal with it.
Yes, indeed. You know, there was a time when they would go to the doctor says, all in your head. But we understand now that menopause for generations now is recognized as a condition of growth, of aging, as it were. But it's often just referred to as menopause, as if it's one thing. Actually, there are 3 stages of it. Can you talk a little bit about the 3 stages of menopause?
The 3 stages of menopause are really perimenopause, which usually lasts about 4 years, where the hormones begin to change. The woman still has cycles. The woman can still get pregnant because she's still putting out an egg every month. And it usually lasts somewhere around 4 years. Then you move into menopause. So menopause is when your ovaries stop producing eggs and you have no more cycles for 12 months. And again, then you are, then that's menopause. That usually happens around the age of 51. Now, that sometimes goes to about 56, 57, when you stop having periods and you have no more periods and still don't. And then your hormones are still balancing, and then you will be in postmenopause for the rest of your life. Now, sometimes postmenopause is brought on, though, as you mentioned before, Henry, with a surgery, such as a hysterectomy, where the ovaries and uterus and tubes may be removed in a total hysterectomy. That woman is immediately put into postmenopause because of the surgery. Otherwise, it's going to be about that time from 51 to 56 and moving forward for the rest of their life. It's a fact. It's not an option.
So how does that affect their daily life then?
Well, when the woman is in perimenopause, they still might have some hot flushes, but they're probably more likely to be bothered by sleep. They wake up in the night and have to go to the bathroom, or they wake up in the night and can't go back to sleep. They may have some anxiety that they didn't have before, or they have irritability, but they're still having cycles. And so when they talk to their friends say, oh, I don't think it's perimenopause because I still have my cycles and I'm not doing that. Then when we move on into to menopause, again, the symptoms get worse. So you have hot flushes at night, you fling off the blankets, and then 2 seconds later, you're putting them back on, or you're getting up and changing your clothes once a night, getting up and going to the bathroom more than once. So those symptoms become very noticeable to that lady. Sometimes that lady in a board meeting will literally have a hot flush and just melt in front of their eyes, where they may take a step back from a position of leadership because of menopause symptoms. And that's a huge loss to all of us. So we move into postmenopause. Sometimes the symptoms get a little bit less, but the longer those symptoms go on, you lose memory. It becomes moodier. You know, we need those hormones for a reason, and when they're not replaced, we do without.
Yeah, certainly. It makes me wonder if having the surgery like that, especially a full one, could possibly be so much of a jarring situation that it can actually cause some sort of mental psychiatric distress.
Well, I think having the surgery, the criteria to have a surgery with a total hysterectomy is quite intense. So it doesn't just happen that we want to stop, we don't want any more children, and so therefore I'm bleeding more than I would like to, and we have a hysterectomy. So there's a certain criteria that has to be met before you do a total hysterectomy. But that immediately puts that woman into postmenopause, and hopefully that provider has prepared her that you will have a drop in your hormones urgently, and this is how we'll manage those. We'll look at those levels and we will replace those hormones if that woman wants to do it that way.
Excellent. So you mentioned several times hormones and hormone replacement. What is bioidentical hormones? What are those, and how do you work with individuals to help them to regain their balance?
So bioidentical hormones are hormones that are usually compounded by a compounding pharmacist, and they're made individual to every woman, because every woman doesn't need the same amount of estrogen or progesterone or even testosterone. So these are not made from horse urine. These are not made in a lab. These are compounded specifically for that woman. And I've trained and interpreted labs for years to determine what imbalance my patient has, how bothersome it is, and what her options are in order to balance that again. And again, knowing that there are numbers of formulations, there's creams and there's patches, suppositories, and then there are injections. So there are many formulations that woman can choose as we navigate her journey and as she has her options presented to her, along with risks and benefits.
You know, the beauty of snowflakes, you might say, is the beauty of a woman, in that no two snowflakes are exactly alike. And every woman is different, even within families. And so that said, is it true to say then that each formulation would have to be unique to that person, or can you divide them into categories?
So each hormone can be placed, some hormones can be placed together. So if I am doing a combination of estrogen and progesterone, that can be mixed together in a cream. Okay, or it can be in a troche that dissolves under the tongue. But there are categories, of course, of formulations, but we work for every woman to have what they need. And usually we start low and we move up slow, because we want to not have negative side effects of an over-treatment with a hormone. We really want to match it. And it's a journey. So it's not, you see once and you're on that same dose forever, because you will go through the stages into postmenopause for the rest of your life.
Well, what are some of those negative effects?
There can, based on the patient's family risk of breast cancer or family risk of clots, blood clots, there are risks with any of the hormones when we supplement them. Our goal is to choose the dosing and the modality that has the less risk. So anything that I use on the skin, or I use it transdermally on the skin, or I use it
sublingually?
Sublingual. Those have the least risks because they don't pass through the liver. And so we make those decisions as far as risks go. But there is risk with any hormones. It's just bioidenticals have lesser risk, and we're making them individual.
So the bioidenticals, you have a bioidentical similar to estrogen, and I mentioned that because estrogen is one of those that a bit too much of it has seemed to be a risk in breast cancer.
Yeah, so bioidenticals are kind of an umbrella where it is made as close to what women made when we made enough of them ourselves. So there's a bioidentical formulation for estrogen, for progesterone, for testosterone, and for DHEA, which is the other male hormone that is the weaker of the two. So bioidenticals are compounded by that pharmacist specific to the individualized woman's needs.
So you can get hold of some testosterone and DHEA as well?
Yeah.
Could you hook me up?
Both of those are again, that balance.
I was just saying, maybe you can hook me up. I can grow my muscles a little bit more. But that's another show.
Yeah, that's another program for another day.
Yeah. Well, what is it that brought you to this point? You've been doing this for years. Why are you so passionate about it? And what's your journey?
So my story is that if I turn the clock back to the black and white days of television, when I was 5 years old, my mom had to have an emergency hysterectomy because she was hemorrhaging. So she brought home my little baby brother, and she had been in the hospital and had surgery. Now, there were 5 of us kids, so he was the last one. So go home and take care of your children. They never talked to her about the fact that she'd had a total hysterectomy, that she would ever need hormones. So she was just sent home as a farmer's wife, because I'm an authentic farmer's daughter, and said, just cope. So from that day on, my life changed. The moods and the anxiety in my household varied moment by moment and day by day. And my mom didn't know why. Sometimes she screamed and sometimes she cried, but she did. And it made an impact on my life. So when I became a nurse and went on to school and became a nurse practitioner, I saw women in my practice whose mothers had gone through menopause without any hormones, and that they reported the same kind of a story. So I became passionate. When I had my hysterectomy at age 42, I was blessed to have an OBGYN who said, we will need to talk about your hormones. So I was blessed that she placed me on bioidentical hormones of estrogen to start with right after the surgery. So my mom didn't have that option. And so it made me know that there were other women who didn't talk to their mom probably, or their grandma. But it made me know that I had navigated that journey. I was blessed to find a mentor that actually helped me with my bioidentical prescribing, to be able to provide that to my patients. So I know that my mom was in her 50s and she finally changed doctors, and she was finally placed on some estrogen. She was a different woman. By that time, I'd already graduated high school and moved out, and I didn't know that lady. So the passion comes from that little girl who didn't know what happened to my mom when she brought home that little brother, but it never was the same. And that's where my passion comes from. I have the ability to help women. I listen, I understand, and I walk that walk. So I feel blessed to be able to serve these women through this journey on their own terms.
Often our venture into this field comes from our personal experience, like myself, having been diagnosed with pre-diabetic, type 2 diabetic, and refusing to go toe the line that they want you to toe, but going ahead and taking my own actions to reverse the illness. And now I help other individuals to do just that, to reverse it, to build their muscle up, to understand that importance. But you mentioned your mom, you mentioned your brothers, and the farmhouse life. I'm just curious, what was the effect on your dad, and how did he deal with that?
My dad didn't know what made my mom cry some days and scream other days. He totally didn't understand. And as a farmer, they would never have that kind of a conversation. They would never talk amongst themselves. They were all related, brothers, cousins, all of that. So he didn't know how to deal with it. So most of the time he didn't say a lot, but he also didn't know how to support my mom through this journey that she had never been through before. It was uncharted territory.
Yeah. Anything dealing with anything that affects our psycho-emotional makeup is definitely something that becomes uncharted territory. It becomes something that we really need to know how to not just navigate, but to seek the support in order to help the one who's dealing with it, as well as the whole family, because it's really the two are one flesh, but then the children, that's an extension of that one flesh, of their body, you see? So that being the case, what do men need to understand about menopause and how to support women, be it their mothers or their wives, their sisters or aunts? Tell us, what can we do?
What I believe that happens for the woman going through menopause is there are brain changes. And so she doesn't necessarily express how she feels because maybe she has never felt this way before and doesn't want to hurt people's feelings, doesn't want to ruin a relationship. And so she keeps it into herself, or she only talks to her small group of best friends. And they'll say, oh yeah, I'm going through that same thing. So what's happening with your family? What's happening in your marriage? And because of the changes that happen in the brain as the hormones adjust and become out of balance, is that she doesn't express herself. And so then things trigger her. So if she doesn't have some mindset practices, some meditation, some music, some exercise, some hobbies that she can express herself in, then the trigger becomes that she gets angry and she cries and she's not understood. So I think if I could share with, and I have with my patients, spouses or partners, if they're open to hearing what that woman is going through, is what she's looking for is understanding that I sometimes don't know why I say things or do things. And sometimes I'm not in good control. But I can always ask for a do-over. Can I go back and do that over again when I screamed at you? And now I realize that's not the real me. It is the menopause symptoms that I'm not really in control of. So I think that we really are wanting support, knowing that that person's going to stand by me, even if I'm not my usual self. And then an understanding that I might change, that there will be changes because of the hormones that I might not go along with everything that I maybe went along with before. So if that man understands this journey and at least is supportive, because we get validation from our best friends. Right. The validation comes from our circle of ladies who, when I say this is what's happening and I don't know how or why, that lady validates that this is happening to me and supports me as best she can. I'm so sorry you're struggling with this. Let me tell you who my provider is. Go have a conversation.
Yeah. And those providers are and I mean the ones that are truly empathetic, can be rather rare. Oftentimes they're kind of driven by the influence of what the insurance company allows, or perhaps their own perspective. Sometimes it's skewed. But when you do find a good provider, when you do find that one who has the empathy, that makes all the difference in any illness or condition that a person may have. But when it comes to men, I would say this, gentlemen, give consideration, learn to take a step back from a situation. And that's one of the biggest challenges when it comes to any one of us. We get caught up in the emotionality of the moment, and that's what drives us. And it's sad to say some terrible things can happen as a result of that. So, gentlemen, fathers, sons, brothers, uncles, understand the women in your life. And understand too that at times, well, first of all, women are completely different from men. We know that, but for some reason they forget that. And so they're not going to think, even if they do like football, okay, right? But that's so vital. And we really thank you for your time here, Ms. Doris, because I think this is a conversation that's a long time coming. And I look forward to hearing more from you. I don't know if we may have to make this a part two, have a part two sometime down the road, because there's so many more questions that come up as a result of this. But for now, I want to ask you this one last question that I always ask my guests. But before I even get to that, I want to ask this other thing, because you mentioned, it just came into my mind, you mentioned meditation, and I was wondering, well, meditation, mindfulness, that's one thing, but are there other exercises that can help with someone who's dealing with the effects of menopause?
Yes, we can never underestimate the ability to modulate the symptoms of menopause by using nutrition and exercise. This can start as simple as just a walking routine where you're out with nature, where you can smell the flowers, hear the birds. Those kind of things help to reduce our stress level. It brings us back out of fight or flight, back into calm and create. It also allows us, and then if we want to have an exercise partner, we want to have an exercise routine, it's again being cautious to not overdo it. You don't want to injure yourself, but you want it to become a part of your routine. So whether that routine starts out with a gratitude journal and some meditation, making sure that we're getting enough water every day. We as Americans are on the verge of dehydration every day.
That's true.
And then finding some exercise that you enjoy, that rather than making a penalty or a punishment, that it's something that you enjoy. Just the stretching, the motion, what we need to do is keep that body in motion. And that's going to help us with balancing those hormones to a point that exercise can, as well as nutrition, which you mentioned in your journey, was in what you changed in order to not follow the normal path of treating prediabetes.
Absolutely. There are so many things that a person can do. And understand that when we move our bodies, that's the first thing, because we want to keep that stretching going, we want to keep the circulation going. But something else that's also important is maintaining, if not building the muscle. One thing about muscle is this: when you build a muscle, and you do not have to look like Lou Ferrigno, God help us, we do not want our women looking like that, okay? However, or the Incredible Hulk. However, we do want to say this: when you are building the muscle, your body responds in order to support it. It does that by strengthening the bones. So if we know that we're going through this, what should pop into your heads, sisters, mothers, aunts, uncles, daughters, what should pop into your head is, what steps can I take to increase the muscle so that it stays, my bones stay strong, stimulates that growth hormone and that capacity, because that's so important. I've seen years ago when I was in the hospitals working, one of the saddest things for me was observing, these beautiful belladonnas, the quintessential proverbial grandmother that comes in, all the noni, she come in, right? But the thing is, they came in screaming because, of course, they put on the weight, they've gone through the menopause, but now they've lost so much calcium, they've lost so much bone density that they took a step one day and their hip bones split. Yeah. You see, such a common occurrence. We can avoid those things if we take the steps. It doesn't have to be huge steps. No. What I do, I take my clients through a habit change, and I help them to incorporate small movements, resistance movements, things like that. So as time goes on, before they know it, they have a routine that they love, they're comfortable with, and it didn't scare them. They didn't have to go to a gym. There are things they can do at home. If they want to go to a gym, that's fine. But what's most important is whatever you do, take that time to take care of yourself. Again, I want to thank you so very much, Ms. Doris. I have to ask you this one last question I ask all of my guests, and that's, Ms. Doris Ziegledorf, with all of your experience and all of your wisdom in this area, what does it mean to you to crush your mountain?
I am blessed that you asked me that question. To crush my mountain always begins with gratitude. So I have a morning practice that includes gratitude, what I am grateful for, what I'm blessed with. I have a daily routine that I learned from my mentor, Mary Morrissey, at the Brave Thinking Institute, and she uses it every time she touches a door handle. It brings a thought of gratitude throughout her day to put me in that gratitude. And then through the evening routine, again, that can be a gratitude journal. It can be regrouping what my day was like. Was there a time in my day when I really wasn't on point, that I may have strayed and come back again? And then it turns obstacles into opportunities. And I believe that that's where I'm blessed with the opportunity to serve these women with my gifts and talents to help them navigate their menopause journey. And I thank you so much for allowing me to have this conversation today.
I want to thank you again. And again, friends, think about that. In all of our discussion today, we really talked about how we can support women in their menopausal journey, how women, these techniques that they can take, the hormone replacement techniques they can incorporate by means of Ms. Doris or other individuals who are in the same practice that she's in. But we ended with the one thing that I think is important for anyone. You know, my mom used to say, you better count your blessings, you know? And strangely enough, being able to do that on a daily basis is phenomenal for the body. So we want to encourage you to take more time for yourself. Examine yourself from within, learn to become settled, and learn to appreciate the simple things that all of us are blessed with. Until next time, as I always say, don't just climb your mountain, crush through it. And we will see you next time. Thanks again, Ms. Doris.
Thank you very much.